Hey everyone, this is Holly Knutson. I'm a functional health practitioner from Utah, and today I'd like to continue my cancer series and talk about mycotoxins and cancer. Fungus creates mycotoxins, which are toxic compounds that can cause a host of ill effects in the body, and this includes immune deficiencies and cancer. These toxins produced by mold grow on common food sources such as grains, coffee beans, and dried fruit. In this video, I'll be sharing facts about mycotoxins and cancer and what you can do to prevent exposure and protect yourself. Hundreds of mycotoxins have been identified, but only a handful have gained notoriety due to their adverse impact on health, along with the degree to which they occur in food. Unfortunately, mycotoxins are pervasive. They're in the food supply, they're in the air we breathe, they're in the walls of our homes, and even in products we put on our bodies. For this reason, it's vital to learn about the sources of mycotoxins, the symptoms associated with them, and how to protect yourself from their damage. Here are some common food sources of mycotoxins. Grains, including wheat, barley, oats, rye, sorghum, and quinoa. Corn, breads and cereals, peanuts and peanut butter, dried spices, dried fruit, nuts including pistachios, Brazil nuts, pecans, almonds, and walnuts, hard cheeses, alcoholic beverages including beer, beauty care products. They can be in your walls and in the tile, in the grout, on glass, in air conditioning vents and heating ducts, in plumbing, in animal feed and pet food, and milk from contaminated animals. Mycotoxins are chemically stable. This means they can resist food processing and cooking. Mold can grow before harvesting or when the food is being stored, especially if the storage conditions are damp and humid. Mold infestation is thought to affect up to 25% of the food and feed supply. Exposure can occur directly or indirectly, either by consuming the infected food itself or indirectly from exposure to animals that have been fed contaminated feed, and this would include drinking their milk. Here are some of the common species of mycotoxins. Mycotoxins are secondary metabolites produced from fungi that can cause disease, and they even have the potential to be fatal. For these reasons, it's not surprising that they are referred to as fungal poisons. They are classified according to the organs they target. Nephrotoxins affect the kidneys, neurotoxins the brain, immunotoxins the immune system, and hepatotoxins the liver. Here are a few known mycotoxins, where they are found, and the conditions they can cause. Number 1, aflatoxin. This mycotoxin is found on peanuts, corn, and peanut butter. It is carcinogenic and is produced by the species of mold Aspergillus. Aflatoxin B1 is extremely toxic and is implicated in autoimmunity, food allergies, cancer, and liver disease. It thrives in hot, humid areas. Number 2, fumonisins. These mycotoxins are found in corn, including animal feed, and in smaller occurrences, sorghum and rice. Fumonisin is produced by the Fusarium verticilloides and proliferatum strains of mold. These strains are tumor promoters that may possibly cause esophageal tumors in particular subsets of the population. They are also implicated in neural tube defects. Number 3, patulin. This mycotoxin is found on rotting fruit that is damaged, especially apples, peaches, pears, and olives. Patulin is produced by the Penicillium and Aspergillus strains and can cause GI disturbances, including intestinal hemorrhage, reduced intestinal barrier function, and ulcers. It is nephrotoxic and immunotoxic. Number 4, ochratoxin A. This is found in pork products, coffee, dried grapes, and wine grapes. It also contaminates heating ducts and water-damaged houses. It is produced by various Aspergillus and Penicillium species. It is one of the most abundant mycotoxins that contaminates food and is potentially carcinogenic and neurotoxic with a high affinity for the brain. Due to its mutagenic properties, it can cause oxidative damage to the DNA and has been found in human breast milk and blood. Number 5, citrulline. This mycotoxin is found in old grains and fruit. It is produced by the Penicillium, Aspergillus, and Monascus fungal species. It is nephrotoxic, hepatotoxic, and cytotoxic, meaning it's toxic to human cells. Zearalenone is commonly found in corn, but also can be found in wheat, rye, sorghum, and barley. It is produced by the species of Fungus, Fusarium graminearum. Grains infected with this mycotoxin have a pink pigment. Zearalenone and its metabolites are estrogenic and may be implicated in precocious puberty in young children. Aflatoxins, patulin, fumonisins, zearalenone, and acrotoxin A are the most commonly observed mycotoxins that are a threat to livestock and humans. Mycotoxins and cancer. A large percentage of cancers are linked to mycotoxins, which are directly correlated to the potential to develop cancer. For instance, zearalenone and ochratoxin signal estrogenically, and this means they have the ability to bind to estrogen receptors on the cells where they stimulate growth and proliferation. In estrogen-related cancers, including female cancers, prostate cancer, colorectal, and esophageal cancers, estrogen itself may not be stimulating the receptors, but rather mycotoxins. Mold toxins are endocrine disruptors, notably zearalenone, which has a higher estrogen receptor binding capacity when compared to other endocrine disruptors like bisphenol A and DDT. Interestingly, intestinal microflora in the human body can degrade bisphenol A, but not zearalenone. Mycotoxins can damage the nervous system, lungs, and kidneys, and they can also damage DNA, a risk factor for cancer. Fungi also have the ability to rapidly mutate. Toxins place a heavy burden on the liver. When the liver can't effectively clear toxins, they accumulate, and this accumulation can negatively impact immune function, which is a significant risk factor for developing cancer because ultimately it's the immune system that will protect you from getting cancer in the first place. How a person reacts to mold exposure will depend on the state of their health and immune system, their age, and the amount of toxins they were exposed to and for how long. Older people and children with compromised immune systems are at the highest risk. Symptoms are also dependent on the degree of exposure. For instance, being exposed to large amounts of mold toxins can cause acute symptoms such as difficulty breathing, headaches, and vomiting, whereas chronic low-grade exposure over time can cause immune, respiratory, and neurological problems, damage to internal organs, and cancer. Fungal toxins can damage every system in the body, and they do this by inhibiting protein and DNA synthesis, along with mitochondrial protein synthesis. They can also impair the functioning of ribosomes. Aflatoxins in particular are carcinogenic compounds that are acutely toxic. They are mutagenic and immunosuppressive, which can set the body up for disease. Immune system suppression can initiate bacterial and viral infections, including herpes and Epstein-Barr, which is the virus that causes chronic fatigue syndrome. Neurological symptoms can be the result of mycotoxin exposure due to the degradation of the myelin sheath that surrounds the nerves, and this can cause muscle twitches and weakness, headaches, and even seizures. Chronic exposure to toxic mold metabolites can lower white blood cell count, further setting the body up for cancers such as lymphoma and leukemia. Low-dose exposures can cause reduced white blood cell count in the GI tract too, which houses 70% of the immune system. The effects of mold exposure are cumulative. Here are some of the symptoms of mycotoxicity, and it can cause persistent symptoms that have no known cause, among which are GI problems, hormonal imbalances, a persistent cough, headaches, difficulty breathing, itchy eyes, rashes, joint pain and muscle cramps, anxiety, sensitivity to light, hair loss, weight gain, poor memory, and lethargy. Autoimmunity and cancer can result from long-term exposure to mycotoxins. Here are some strategies to protect yourself from mycotoxins. Removing yourself from the exposure is the first step in preventing and exacerbating mold toxicity. Now, this is hard if you have mold in your house that you're being exposed to on a daily basis. Consult a professional who can confirm that you really do have mold and what can be done to rectify the problem. And remember, it's also possible that your workplace may be contaminated as well. There are strategies you can put in place to protect yourself from mycotoxins. Begin by changing what you eat. Ideally, eliminate grains and corn from your diet because they're two common sources of mycotoxins. These foods are inflammatory and hard to digest anyway, so it's a good idea to eliminate them. If you must eat them, make sure they are non-GMO and organic. At the very least, just don't eat them as frequently. Add to that the fact that most corn sold in the U.S. is GMO, and that's just another reason to not eat it. Reduce the amount of sugar you eat and the amount of alcohol you drink. Soak, sprout, and ferment your grains, nuts, seeds, and beans. This will reduce the occurrence of mold and will minimize their harmful effects. And store these foods in the freezer to prolong their shelf life. If for some reason you can't do this, store them in a cool, dry place with a moisture level ideally below 14%. Replace peanut butter with other nut butters, which are less likely to contain mycotoxins. Buy your produce from local farmers or food co-ops and buy only grass-fed meat. Do a parasite cleanse once or twice a year to eliminate mycotoxins from your GI tract, and periodically detoxify your liver with liver cleansing herbs. And infrared saunas can stimulate detoxification through the skin. Here are some other precautionary measures. Invest in a high-quality air filter to clean the air of mold spores. I use an ozone air purifier in my bedroom and run it all night, and I'll put the link underneath this video. If you already suffer from respiratory or allergic reactions, mold exposure will intensify these symptoms. Interestingly, indoor air has been found to be even more toxic than outdoor air. I bet you didn't know that. Keep your house and especially your basement and bathrooms well ventilated. The primary method of exposure to indoor toxins is by breathing in mold spores that are in the air. You can also use a dehumidifier to reduce moisture levels in the air. Water is a breeding ground for mold, so watch for any leaks and fix them immediately. Ventilate your bathroom after showering by opening a window or turning on a fan for up to 20 to 30 minutes. And wipe down the shower after you use it. If you have a swamp cooler, drain it regularly. Install exhaust fans in your kitchen, laundry room, and bathrooms. Check that your gutters and downspouts are clean and draining properly, a safe distance away from the foundation of your house. Okay, can you clean moldy areas? If you know you have mold in your house and the area is larger than 3 foot square, you'll want to hire an expert to get rid of it, especially if it's in your walls, and particularly if you have asthma, other respiratory conditions, or a suppressed immune system. If the mold is contained in a small area, you can try cleaning it yourself with ammonia, bleach, or white vinegar. Surfaces like glass and tile will be much easier to clean than wood or sheetrock. Always wear a mask or N95 respirator over your nose and mouth to prevent breathing in spores. Wear gloves that cover your entire lower arm. Goggles will protect your eyes from mold spores. White vinegar that is undiluted can be used on hard surfaces in bathrooms, laundry rooms, and kitchens. Bleach will also kill mold. Use 1 cup of bleach per gallon of water. Apply to the moldy surface and leave on without rinsing. If you have moldy grout, you'll want to add a little dish soap to the bleach solution because this will help penetrate surfaces that are porous. Be sure and rinse the area if you use dish soap. You can also use a 50-50 solution of water and ammonia. Spray it on the infected area and leave on for 3 hours before rinsing. Never use ammonia with bleach or all-purpose cleaners because it will emit toxic fumes. If you have mold outside on a deck or on siding, remove it immediately. Mold can damage exterior surfaces such as stucco and wood. Most significantly, it can eventually make its way inside. Generously spray a 1 to 10 bleach and water solution on the area, then use a stiff brush, dip it into the mixture, and scrub the area. Leave the solution on for up to 20 minutes before rinsing with a hose. And please wear gloves to do this. Here are some natural remedies and herbs to help clear mold from the body. Antifungal herbs such as garlic, ginger, and cayenne. Oregano oil, which is a natural antifungal, as is caprylic acid. Magnesium is really important to take because it detoxifies yeast toxins and mold. Chlorella binds mycotoxins. Chlorophyll cleanses the blood and is antifungal. Allicin, which is a garlic preparation, has powerful antifungal properties. Probiotics bind toxins and prevent their absorption. Pico silver is a great supplement to support the immune system, and vitamins B and D boost immunity. You should also use binders such as activated charcoal, GI detox, or clays to bind mycotoxins and eliminate them from the body. However, only use binders if you are not constipated, because they can make that worse. There are many strategies you can employ on a daily basis to prevent cancer and other health conditions. Reducing your exposure to mycotoxins is key, as is awareness and education. Know where mycotoxins lurk to mitigate your exposure. Clean up your diet, store food in the freezer or a cool, dry place. Take natural supplements to detoxify mold, and implement detox techniques to decrease the toxic load on your body. Did you know mycotoxins are implicated in cancer? Let me know what you think in the comments. Thanks so much for watching.